have cons and pros, and we want to insist that all the others have pros. The message should be, this one has a pro, it has a con, just like all other methods. But since we have gotten into this discussion, we can further it further, but space. Thank you very much.
Thank you so much, Doctor, for that submission. And really, I think the most important thing is that we are picking from this panel is that all the faith groups are getting proactive. They are taking action, they are looking at, and that has always been the emphasis. Can we, for example, if we are talking about sexuality education, can we look at the content that works within our faith perspective and put it in work? And then maybe the other content, we will progressively see if we go into it, rather than saying, okay, the whole thing is bad. And I think that's what is happening with family planning, and it should be able to happen with most of the other key aspects of sexual reproductive health. And with that, you'll find that in the long run, we are tailoring the whole concept into what works within the faith environment. And we thank you so much, Doctor, for that leadership you are providing to the Catholic Church to move in that direction. So can we listen from the Muslim perspective? And here we have Che. I just want to let us know that we are getting back onto NBS. So our audience on TV are joining us. We welcome you back. We have had a lot of discussion, but you have joined us also at the right time where we have a lot going on. Yes, thank you.
Yes, thank you very much, Mr. Moderator. I'm Muhammad Ali Aluma. I head the Social Services Department at Uganda Muslim Supreme Council, whereby health falls under my department. Children, talk of youth, and many other, they are under my department. The topic here was very clear, that the role of religious leaders in promoting adolescents and young people's health practices and success stories. As Uganda Muslim Supreme Council, the first thing we did at adolescent as a challenge that is surrounded by specific age. And within that age, we looked at the environment that these young people live in. Unique, it is challenging, it comes with a lot of behavioral change. And through that, as Uganda Muslim Supreme Council, we came up under social services with population program department, basically looking at the aspects, because when we are talking of the adolescent, we looked at the risk that comes out of it, and specifically now the health risks that comes under that. So through that, which we are having HIV/AIDS, look at teenage pregnancy, talk of early marriage, and many of these other aspects that affects them. And we came up with a Department of Population program that looks at HIV/AIDS, looks at gender-based violence, looks at these other aspects of teenage pregnancies and many others. At the same time, as my colleague doctor said, the Uganda Muslim Medical Bureau is a technical arm of Uganda Muslim Supreme Council that looks at the aspect of health. So they are our technical arm in line with that. We have health facilities and many others. Several of these activities he mentioned is under that department. So we've been carrying out a lot of activities in line in our madrasas, the madrasa programs, evening times with our children, the young ones in mosques, in the madrasas, the weekend programs that has been there to educate them. The greatest challenge that we have seen in line with the child upbringing, we have challenge with the parents. Nowadays, parents are very busy carrying out a lot of other activities and forgetting their responsibilities at home, which drastically affected the upbringing of this child. Me personally, if I look around, I think I'm the youngest. Yes, so I'm youth. And sincerely, all of us, we have gone through this stage. And we've known how it is and how challenging it is. Thank God that today, SRH Alliance, Faith for Family Health is coming out, shouting loud that you people, there's this challenge. Can we partner and work together so that we curb up the challenges we are talking of? There's a lot of teenage pregnancy. There's a lot of abortion taking place. We are experiencing early marriages, which is presided over by some of our leaders. You find a sheikh presiding over a marriage of a very young lady. Why? So this is the time that we have to come together and work. We see how best we can use the strength. I'm sure SRH Alliance and Faith for Family invited us here for a purpose because they know the ability that we have. They know that we have a strength. Therefore, our strength must be used to see that we work towards the challenges that is before us. And through that, I would suggest the following that we should do. We can use our faith channels. All these that you see before you, we have different channels that we can use to give the information. Other platforms, we have schools. All the places of worships that we have a lot of programs that takes place there. So why can't we streamline such programs and have it within our systems so that we can now guide our young ones and give them the best? The second suggestion, we need to make our health facilities or other institutions or our structures adolescent and youth friendly. The moment we do that, we shall have the better youth that we need. We also, as we know very well, we are stakeholders. Can we guide and work together with government in developing the policies? Because you already know the challenges that are there. SHR is fighting, working with government, trying to persuade them. Can we add our voice so that we can have these policies in place to support our young ones? Can we also strengthen health education in all our structures? One, by capacity building. Yes, we are doing what we can, but I feel it's not yet enough. If Mufti can come here and talk, Bishop comes here and present, can we invite the county sheikh down, the imam down there, can he present the way Mufti did so? No. So the information that we have is very good, but if we want this to go down, so we need to build the capacity of our leaders through the structures so that we can have the best. Then we coach and mentor the health workers so that they will also know how to handle these categories of people. We also need to reach out to adolescent and young people. It's very important. Let us not look at them as a burden. Let's not look at them with, the behavior. When the behavior changes, they do anything. So we need to bring them, as Father said to us. Lastly, we also need to engage the donors to support most of these activities that we are talking of. I'm sure the cultural leader yesterday presented, and today one of the leaders, religious leaders, also presented that one of the things that affect our activities is lack of funding. If Canon here came out very clearly and talked about what he knows that is right, why can't we fund him so that he can promote the information that he has? The gold thing that he has is that information, so why can't we promote that? And it's the same thing with all the faith-based organizations. If we have donors come together with us and we try to work towards all this, we shall work very good. Thank you very much.
Thank you so much, Sheikh Ali. That was really, really good, and we appreciate the great work being done by the Muslim Church. And I think Muslim faith. I apologize about that. Okay, but we are one in faith, so yes. But the emphasis that you're making around the need for us to be proactive, and we have all the structures. Maybe we want to hear more as we make we go through the commitment. How do we use these structures? How do we take advantage of the structures? We have radios, we have health facilities, we have a number of church programs that we use every day. And that's a platform that can take the message really far. And so how can we use that for this purpose as well? And one of the main things that have come out very strongly from your submission is the commitment. Because if we have the Mufti come here and we have all these leaders join us here, then it means the commitment is there. What we now need to work on is to strengthen that capacity to be able to deliver that. But we have one final submission from a panelist who is joining us online, and that is Godfrey from the Pentecostal Church.
Thank you. Hope you can hear me clearly. Not Godfrey, Geoffrey, and from Born Again Faith. I want to recognize both the cultural and religious leaders' protocol observed. I'm going to tailor my presentation or my discussion on the support being given by Faith for Family Health Initiative in conjunction with the PAI. We are implementing a one-year project in Mayingo, and specifically it is an advocacy project. This particular project is advocating for family planning and the increasing of funding, family planning in the district. Ever since we started implementation, that was in RFM, prior to that, the district had already developed what they call a district costed implementation plan, which is a guiding tool on how the district envisages how to implement family planning activities, obviously with the issues of young people inclusive. And specifically, in that plan, there is priority 1 and 2 that talks about the adolescents and young people and funding for their family planning needs. And to date, ever since we started, there has been significant success, I can say. What happens is the institutions in place, for instance, could be having the resources, could be having the staff, but just a small reorganization. But through our interactions, if I can hint on a few achievements, is that already they have started, they have a budget line for this financial year. Can you imagine for the previous years, as a district, they didn't have a budget line for family planning. And already money has been committed to that purpose. In also our interaction with them, we managed to secure free radio programs being hosted by the IC. You know, it is a mandate now for those community radios in districts to give airtime and publicize their programs. So we tapped in one of those. Unfortunately, in Namayingo, we went there and we found a family planning champion, the RDC. He had undergone a vasectomy. And he really is helping us achieve a lot, mostly for the young people, as far as family planning is concerned. And right now, in place, just in a short time, their partners, we have quarterly meetings. The reason why we are bringing all the partners on board is because some of them have resources to avoid the kind of work. Now we are synergizing our efforts and our strength to make sure that the needs are met in time. By the end of last month, the district leadership, for instance, came up with even a commitment. This commitment, in fact, it was signed by the COW, the RDC, the LC5, the representative of religious leaders, representative of 3 FHI, to make sure that they commit in funding and prioritizing family planning for the young people in Namayingo. And through that commitment, because last Friday I was in Namayingo still for a follow-up meeting, and already there is tremendous success. Can you imagine the district had developed a family district-costed family planning implementation tool, but had not disseminated it to the different key stakeholders. But already now, everybody is being brought on board, given the fact now there was a transition of new leadership. Now they have the plan in place. There is a budget line, both at the district level and the health center level. Fortunately, there are different programs. For instance, there is what they call RBF. That is a performance-based financing. That one at the health centers, there is a lot of money that can be tapped, and health initiatives have been urged to utilize some of that money to make sure that they integrate family planning in their programs. Then recently still, can you imagine that even when you talk about youth-friendly corners, they say, okay, we are trying, but there wasn't a sketch. But we agreed, and when I go for follow-up, I will still make sure it is that. But we agreed that they should. Even if, for instance, a facilitator is not having a structure where the youth can gather, but can they have a person designated to handle and talk to them as youth? Because it is difficult for them to come and easily open up to an old, tired clinical officer, maybe like of my age. The youth will be secretive and not easily open up. So we are making sure that that one comes on course. The reason why I brought all this information to this forum is to show us that as government, there could be, in fact, there are resources. There are resources. It is just a matter of the organization. Because the districts right now, they have to run. Now they have working documents which were fully signed. We have copies, and they are committed to achieving whatever was set out to be achieved. We brought, for instance, the DEO on board because we know that schools are a hub of our young people, and the communications are made to different schools to integrate to ensure that adolescent-friendly information is accessed and provided to our students in school. The council, for instance, the district council, and specifically the Committee for Health and Education now has committed money even for monitoring to make sure that these needs are supplied to our young people. Definitely, Namayingo is a unique district, given the fact that it is bordered by, or it is in between the waters. Such a population.
Excuse me, Godfrey, we are quite running out with time, so we request you to summarize. We have other sessions that is going to follow this.
Okay, please.
Yes.
Okay. In brief, that is what we've been doing, particularly the project. And I know, given time and given more resources, since, as Jack intimated, this is a pilot project, we can achieve more, because you can imagine in a very short time we've registered commendable success. So I know once we synergize our efforts for the different religious institutions, we can reach out. Even when, for instance, you don't have the resources and there is a nearby health center, you can contact somebody to come and provide a service that you can't, or you can refer a youth to that particular center. I want to thank you, and thank you for recognizing.
Thank you so much, Geoffrey, from the Born Again community for the great work. He deserves a big hand clap. And I think one of the things that they are doing differently is around the partners they are bringing on board. I think that adds value to our conversation, that if you really have a clear program and you invite us partners to integrate within what you are doing, we are able to mobilize resources here and there and continue the work that you have. So I want to take this opportunity so much to thank you all, but before that, let me welcome back the head of the Pentecostal community, that is Serwada, Apostle Serwada. You're most welcome back. We're glad to have you back for the closing session. So we are moving towards the closing session. I want to thank you all for your submission. I would have given you space to say one word.
I actually want to say one word, clarifying on what my brother said there. Did I hear it properly? Family planning for young people. Now, Church of Uganda does advocate for family planning, but family planning for people who have families. We are very, very, very stringent on saying family planning for young people, because that gives a lot of room for you to give ideas for people who want to do things for young people. So I want to propose that while I agree that faith leaders advocating for family planning, we also are not advocating for family planning people who have no families. And we need to be very clear on that. What are we giving? What are these issues that we're giving to young people in view of family planning? Otherwise, we may have to confuse ourselves. Family planning, for us, family planning to be for people who have families. So I don't want to be on record for saying I'm giving family planning items for young people who are actually, like I heard my brother say, I don't know whether that's what I got right.
Thank you for that clarification. I also want to, with that, please thank you all for your participation. A big hand clap to the panelists for the great submission, and we appreciate the great work you are doing. Allow me to recognize and welcome Her Excellency Karen, the Dutch ambassador who has joined us online. Your Excellency, you are most welcome to the closing session of the Interfaith Dialogue. And with this great submission, we have been taking note of all the discussions and some of the actions that have been recommended, and we are moving towards the closing session. And with that, allow me to welcome Reverend Everett to come and spearhead the closing session. Reverend, you're most welcome.
Thank you so much. I believe we are still strong enough to close. This session is not going to take long. We are conscious of the time that we have remaining. So allow me to constitute the team, the panel that is going to spearhead the closing. And with us, we have Apostle Dr. Serwada taking the front seat. And we have Reverend Dr. Kakoza representing the Archbishop of the Church of Uganda. Please take your seat when I read your name in front. And then we have a representative from SDA Church. Please save time, let us take our seats and we close. You are welcome, Dr. Serwada. Welcome, my brother from the Orthodox Church. And we have a representative from the Catholic Church. Please take your seat. Catholic Church and the Muslim, Uganda Muslim Supreme Council, please come forward. Reverend Dr. Kakoza, representing the Archbishop of the Church of Uganda, please come forward, take your seat. Thank you very much, and I'm happy to be part of this closing ceremony. But before the closing ceremony, we've been here the whole day, and I guess we have deliberated, we have come up with issues that are very important to inform the way forward for the cause that brought us here. So allow me at this time, as part of the closing, to make a declaration of what has transpired right from the start up to now. And I'll ask my brother, Reverend Father Constantine, Secretary General Uganda Joint Christian Council, to take us through this. The main issues that we discussed in this place and which will inform our way forward, because the process has just begun. God bless you.
Thank you very much. As you have heard, I'm the Executive Secretary of Uganda Joint Christian Council. And so far, this is what we deliberated. In case you find that it is not what we really said, you'll get time to oppose or to support, opposition and whatever. Thank you. Statement of commitments made by religious and cultural leaders on the promotion of adolescent health in Uganda during the second interfaith dialogue on adolescent health. 8th June 2021, Hotel Africana. We, the leadership of the different faith and cultural institutions gathered in today's dialogue, acknowledge that poverty, HIV and AIDS, gender-based violence, female genital mutilation, and cutting and low participation in secondary education affects the health and well-being of adolescents and young people in Uganda. We are aware that the traditional practices, this thing is making me uncomfortable, sorry. We are aware that the traditional practices of child marriage, unintended pregnancies, and early motherhood present a major obstacle to achieve progress in the health of adolescents and young people. We note that implementation of child protection laws, policies, guidelines, and frameworks are weak. As a result, children are exposed to right abuses, violence, and discrimination. We acknowledge that there is consistent lack of adolescent and youth-friendly services across the country. Pursuant to this realization, we, the faith and religious leadership, commit to 1. Use our faith channels, platforms, schools, places of worship, and other structures to reach out to adolescents and young people with health preventive and promotive messages. Make our health, too, make our health facilities, education institutions, and other structures adolescent and youth friendly. 3. Develop policies, strategies, and frameworks to guide our in-reach and outreach programs to adolescent and young people. 4. Meaningful involvement of religious and cultural institutions, leaders in the design and implementation, monitoring of adolescent health programs and policies at all levels. 5. Establish a cultural and religious institution coordination mechanism on adolescent health. 6. Strengthen health education at our health facilities and extend capacity building, coaching, and mentorship of health workers on adolescents and maternal health. 7. Assure targeted programs and reach out to adolescents and young people at risk with health information and services. 8. Source, generate, and provide data on the status of adolescents' health to enable government, donors, and development partners make decisions and take actions to promote adolescent health. 9. Build institutional capacity of religious and cultural leaders on adolescents' health promotion and assure mainstreaming at all levels. 10. Introduce and strengthen youth days, activities, and programs in our religious and cultural practices, rituals, ceremonies, and events. 11. Engage donors and other development to avail resources to initiate and promote adolescents' health programs with specific resources allocated to faith-based organizations and cultural institutions. 12. Meaningful involvement of the young people in health programs and policies. 13. Engage media platforms and on issues of young people for better health programming, policy implementation, and reaching out to the young people. 14. Appropriate adolescent health message packaging and language. 15. Promote positive parenting behavior among parents. 16. Engage with the government to ensure that 1. Adolescents' health is prioritized in the government development budgets and plans. 2. Child protection laws and policies are developed and enforced. 3. There is adequate provision of quality adolescent and youth-friendly services. 4. Expedite implementation of the parenting guidelines and ensure completion and approval of the family health policy. What we have heard is what we discussed. Thank you.
Thank you very, very much, Reverend Father Constantine, for presenting the declarations. At this point, we can only add at a later stage, but probably because we cannot go into discussion again, but I want to believe from what I heard, the 15 point declarations, the 16-point declarations speak to what we discussed here, and I guess the language is okay. If the language is not okay, we still have room to revise and polish whatever ideas, good ideas we have. So thank you very much. At this time, allow me to ask our elders in the faith represented here. I am giving you 2 minutes each, strictly 2 minutes, to make a few remarks. 2 minutes is a lot of time. A few remarks, 2 minutes each, on these declarations.
Thank you, Reverend, for a declaration of this nature with the 16 points. Ideally, we would have been looking at the write-up so that we commit to what you have seen with your eyes, because the ears also had masks occasionally. But I think we'll get the written document so that we agree with it. My comments are this. In 2016, the Uganda Demographic and Health Survey found that 35% of the women had never heard about family planning messages anywhere. They had not heard about family planning. Of course, things have changed since that time. With the advent of COVID and everyone listening to their radio critically to hear when the president is going to lock us down, everyone is listening, and I think there is an opportunity there. But for the 35% that had never heard, and I know that Friday, Saturday, Sunday, about 14 million people listen to their religious leaders. Before of course, lockdown. These days, people are watching on TV even when they are eating popcorns while listening to the sermon. We have a great opportunity of passing through the faith leaders to deliver the messages of family planning and adolescent health. I submit.
Thank you very much for keeping time. And the document is before you, so you will continue to look at it. Next, we have Reverend Dr. Kakoza, representing the Most Reverend the Archbishop of the Church of Uganda, if I want to be brief.
Thank you, moderator. My comment is on policy implementation, which was actually talked about by our chief guest during his delivery of the keynote address. It appears as one of those impediments to our effective delivery as far as young people's health is concerned. So I want us to remind ourselves, as Reverend Canon Evers put it, that as we are designing these policies, we need to involve the key stakeholders. And at this particular moment, I want to give an example of the National Education Sexuality Framework. And I read somewhere that it has not been well implemented because religious leaders were not fully involved. So my prayer in this regard is to be cognizant that the formulation stage should be well planned before. Review of the policy should be put into consideration. Context of the policy, because that policy that I have given as a case had issues with the context, should as well be put into consideration. And then the issue of involving key stakeholders, not a top-bottom, but a bottom-top approach. With that, we shall be able to generate policies and not to shelve them, but policies shall be able to be implemented because we will be stakeholders in sanctioning them. Thank you.
Thank you, Reverend Dr. Kakoza, for the remarks. I'll go to my brother, yes, SDA, then end with
I'm happy for having been part of the team and the group that have been able to come up with these 15 statements. And I think they represent our aspirations for our younger people and the future of the nation. And therefore, on the behalf of the Seventh-day Adventist Church, I think we will take them good heart. I will present them. I am happy that we said we have at least a week before we officially sign the official declaration. So I think we shall take them and present them to the hierarchy of the church such that we can officially embrace them for the betterment of our younger people.
Thank you so much. Then we have our brother from the Muslim community.
First of all, I would like to thank the Almighty God who has given us this great opportunity. Today we are here and we have diligently discussed about adolescent and young people's health. I also thank the organizers for this wonderful program. It is really very good that this program today, I managed to have the two of my seniors. The topmost, His Eminence, the Mufti of Uganda, was here, and he presented about the same thing. That shows the need of having this commitment. Upon that, we don't have any challenge with it, and we are ready to append our signatures to these 16 points that we are committing to. I thank you all.
Thank you very much. I can see you are all very good time managers. At this time, allow me to once again welcome our elder, the presiding Apostle Born Again Faith Federation, Apostle Dr. Serada is going to give his remarks and also give a vote of thanks on behalf of all of us. Apostle Dr. Serada, you are most welcome.
Thank you. As you heard, my assignment is very simple. It's got 3 parts. 1, I'll start with our commitment. On behalf of the born-again faith community in this country, which community I represent on the Interreligious Council of Uganda, we would like to fully commit, I would like to state that we fully commit to these simple, basic, but realizable commitments to achieve the best for our young people in providing health and other services that will boost their well-being. All of the 16 are acceptable to us, and we are happy to be part, and so we will append our signature without any reservation. Secondly, my other assignment is to offer a vote of thanks on behalf of the Interreligious Council of Uganda, on behalf of the Board and Management of Faith for Family Health Initiative, the 3FHI, and on behalf of the born-again faith in this country and my own personal behalf, I'd like to appreciate this partnership with SRH Alliance to ensure successful organization of this high-level national interfaith dialogue on adolescent health where key issues have been discussed and agreed upon on the interfaith commitments to ensure better health for the youth. On behalf of the 3FHI, please allow me to recognize and appreciate the following. 1, development partners that have supported this event, including PAI, UNESCO, and many others that have been recognized before during the numerous speeches we all heard. 2, once again, SRH Alliance and all civil society organizations that have partnered with us. 3, governance, management, and staff of the 3FHI for hosting and convening this brilliant meeting. 4, cultural leaders, senior cultural leaders, and religious leaders who participated and provided guidance on this massive subject of adolescent health. 5, government representatives, especially Ministry of Health and Ministry of Gender and their officials, and the entire government of Uganda. We really do appreciate. Number 6, all our online participants, interfaith religious leaders from different districts, example of Mukono, Wakiso, we had in Toroko, Ibanda, across the country, CSOs, development partners, and all the youth. And number 7, the media fraternity. You did us well. And more important, we are grateful to the ambassador of the Netherlands in Uganda for gracing this occasion, and we look forward for more partnership to advance adolescent health with your support. Once again, I want to say thank you so much, and I would like to now invite in a very special way His Excellency, the Ambassador of the Netherlands in Uganda, to speak to us.
Probably just a minute before we invite the
Excellency.
The Excellency, Her Excellency, the Ambassador, we have a very important task we are going to do. Our representatives are going to come here and sign as a confirmation that this declaration we have made here is not fake but authentic, and thereby signed by the stakeholders. So I will invite you right away to come and sign for us in confirmation that this declaration is actually yours and not someone else. That will then sorry for giving you a lot of exercises. You need it. Yes, we are now at a ceremony for signing the declarations, 16 of them. Very, very important declarations that we are making today. It is historical, and I know it will go a long way in transforming, I use the word transforming, programming for the young people in regard to their health. Of course, these are the religious leaders signing in commitment that they will from today on, they have been doing, but they want to put more effort in supporting and prioritizing the work of young people and health and all related programs in our country. Thank you very much, our religious leaders. We appreciate you. Yes, together with us, we have the Prime Minister. We have the Prime Minister representing the cultural leaders, the Prime Minister of Toro Kingdom. Sir, OHT Wasebo, welcome. Come forward and sign, because you have been part of us. Remember to keep your mask very well put on your face. Mind your nose, because we are amidst COVID. And sanitize and sanitize and sanitize. After signing, we take our seats again, take back our seats, our elders, and then proceed from there. Thank you very, very much. I can see the signatures very well put. Leadership is key. Together we can. Together. Doctor, you can take your seat. Thank you very much. Why don't we put our hands together to thank? This is a very important exercise. If they refused to sign, definitely would have wasted our time here. Thank you so, so much. At this time, allow me to welcome Mr. Jackson Ikweko from SRH Alliance to come and make some remarks, after whom we shall invite Her Excellency the Ambassador. We have not forgotten our Ambassador, very important person here. Jackson, please come forward. Oh.
Thank you very much. I'll be joining on video link. Am I heard?
Yes, you are heard properly.
Okay, thank you very much. Our guest of honor, High Excellency, the Ambassador of the Royal Embassy of Netherlands. I have come in to make a vote of thanks on behalf of the SRH Alliance, the organizers of this very powerful dialogue. The eminent leaders, His Eminence, the Mufti of the Muslim Supreme Council, the bishops in the meeting, the government representatives, especially from the Ministry of Gender, Education and Health, our distinguished cultural leaders, the Prime Minister of Toro, Bwamba, and other institutions present and their representatives, other distinguished leaders in our midst, our colleagues, Face to Action, who have been part and at the center of organizing this function alongside SRH Alliance, our development partners, UNFPA, the Netherlands Embassy, PAI, who are part of the contribution to this meeting. On behalf of the Board of Directors of SRH Alliance, an alliance of 8 civil society organizations, including Reproductive Health Uganda, Spectrum Foundation, Rinjahan Uganda, Center for Health and Development, UDIPA, the Organization of Young People Living Positive to HIV, NAFOFANO, the Alliance of AIDS organizations in this country, 8 of us. We wholeheartedly want to appreciate the eminent leaders who have made very insightful contributions and have made commitments towards the promotion and furtherance of access to sexual and reproductive health of young people. We all know that the young people are at the center of our hearts, not only by virtue of them being our children and being the future, but they also constitute the majority of the population of this country. No programming, no clear-minded government will focus on any other issues beyond targeting the bulk of this population, and that's the young people. No wonder, not only are we discussing them in reproductive health, but we are also discussing them in our respective faith institutions, because they are the center of every action. They are in politics, they are in governance, and for the same reason that we are joined today, bringing together various stakeholders under the theme strengthening based actions and collaborations for young people's health.
Yeah, Jackson.
I wish therefore to appreciate
Jackson, you have
the
1
two
minute.
organizations, SRH Alliance and Face for Action.
Jackson,
I want to appreciate the discussions that have gone in. I also want to reiterate the commitment of the Netherlands Embassy, and it has been demonstrated by your presence, Your Excellency, in promotion of the health of young people in this country. You have devoted resources, you've offered technical support, and we shall continue to appreciate you and other key stakeholders in this direction.
Thank you, Jackson. Thank you so much. Jackson, thank you so much.
I just wanted to conclude.
You can conclude.
Okay, thank you. I just wanted to conclude by saying that the young people who have demonstrated the need for empowering them to take leadership in their affairs, we shall continue as an alliance. We commit ourselves to work with the young people and to work with the various stakeholders in ensuring that the health of our young people are protected. We want to thank the religious leaders and the cultural institutions and the leadership of the respective ministries for this support. Once again, thank you so much. And on behalf of the directors of the Alliance, we want to appreciate you, and we shall commit ourselves to continuing furthering these discussions at national, at the regional levels.
Thank you, Jackson. Thank you so much. Thank you for those powerful remarks. And at this time, allow me to invite the Reverend Dr. Kakoza to invite Her Excellency the Ambassador to make her remarks right now.
Thank you, moderator. On behalf of this august house and on behalf of His Grace the Archbishop of the Church of Uganda, whom I am representing, allow me to commend Her Excellency the Ambassador of Netherlands, first of all for gracing this auspicious function. And at this juncture, permit me to take this opportunity to invite Her Excellency to come and address this assembly. Thank you.
Thank you very, very much. Your Excellency, you are welcome. I can't introduce you again.
Thank you, and it's an honor to join you. Can you hear me well?
Very, very well.
Good. Esteemed guests, all protocol observed, good afternoon. And it's quite a special and diverse crowd I'm virtually facing today. Representatives of faith-based organizations, of government, UN organizations, civil society, and most importantly, the young people that are present in this dialogue. And a special word of thanks goes to the Faith for Family Health Initiative and the SRH Alliance, the conveners of this very important meeting. The Netherlands and the SRH Alliance go way back to 2011, when the first seats of the alliance.
NBS happening now.